Introduce myself. I'm Sarah Burns. I'm Head of Communities for Croydon Voluntary Action. So the CVS, is that Brian I can see? Hello Brian, I'm sure Brian's been able to tell you what our CVS is, but it's an ex-colleague of mine. But we're the umbrella body for the voluntary and community sector. So it's, I'll say a little bit more about that, but the purpose of it is to build stronger communities for social change. And we do that in a number of ways. Essentially we have the Volunteer Centre, some of you might be familiar with that, it's in Central, for which we help other groups to recruit volunteers as well as have our own volunteers. We do a lot of capacity building across the voluntary and community sector, so that means support to grow, essentially, support with setup and training, support with governance and budgeting, but also to meet funders and one-to-one support with writing bids. We bring communities, we advocate strongly for neighbourhood work and engaging with people. So for the last 10 years, we've been basically really championing a methodology called asset-based community development. And whether you've heard the term or not, a lot of it's going on here by the sounds of it. It's about really asking people what they care enough to act on and what's stopping you, and having a process to go by involving people in the community and recognising the strengths that we have all got to contribute to it. So, I've heard much of that today, about the strengths and realising the strengths that we've all got to bring, and it's an important thing, part of our work. Another part of being the infrastructure body for the voluntary sector is through networks. So we collectively bring people to, the groups together to work on common themes and to see how we can support one another. So one of the ways we're doing that is on the 21st of October, you're all very welcome. We'll have an online event with Croydon Council looking at the kind of challenges that they've obviously had in their crisis and how that's impacting on the voluntary and community sector. So this is the sixth in a series of meetings where we've said to the council, it's not good enough to just immediately cut the voluntary sector. How can we look longer term than that? How can you work with us for a sustainable, stronger community? So we're getting a lot more positive response from that now, less so when the immediate financial crisis hit, and we're getting the council kind of saying more that they're interested in this community renewal plan that we can work on collectively. So we'll be doing that on the 21st of October. But much of our work, yes, I mentioned the neighbourhoods, other networks, that we host is of course the Food Bank and Soup Kitchen network. I'll say a bit more about how that evolved in a moment. But there's other networks too, like Young Londoners Fund Network, where we bring young people's organisations together. We've got the Refugee and New Communities Forum, where we bring groups together. It's always about seeing, making sure people know each other and can see ways to kind of share resource, support one another, and hopefully nurture those kind of foundations of partnership working. So partnership working is a major part of what we do. We do collective bid writing for some of the big partnerships that we have in Croydon. We were successful earlier in the year with a partnership bid around serious violence in West Croydon. It was a Mayor of London again funding. It was a large bid, £750,000, for grassroots groups, so to get them into the organisations working on serious violence in the borough. We also recently, through the network, put in a partnership for healthy food neighbourhoods. We could only work with 3 partners who came forward through expression of interest to say we'd like to be a part of that bid with the big lottery. So we're waiting to hear for that. That's the kind of thing we do as an infrastructure body. But moving on to talk about how we responded to the crisis as the CVS of the borough. We took on very much of a coordinating role when the crisis hit. What was clear, first of all, was how brilliant mutual aid groups were, how strong we were within our communities to respond so quickly. And we were really fortunate in Croydon that some of the mutual aid or the mutual aid leaders were all very strong. Really had good, solid mutual aid leaders, many of which from the teaching profession, so we're in good hands. And essentially we worked with them from as soon as the pandemic started, and the fallout was immediate with people who had been, just about coping, no longer coping, and we saw periods of that fluctuate with different groups over the whole period. But that happened straight away with the first lockdown, and mutual aid were wonderful. We also were blessed with community responses from groups and organisations across the borough, which, despite, I think there was a misunderstanding that groups wouldn't continue, they would, but actually many and most did find a way to continue and navigate a way to support people despite the challenges of not actually physically being able to get to them. So it was commendable, the creative solutions that came from that challenge. So what we did was to try and coordinate. So first of all, we did a tiered approach. So we worked with mutual aid, the council, the neighbourhood care groups, and Age UK. And we looked at a tiered approach. And CVA's response to kind of people coming in crisis was to say, how can we link them back in with the wider voluntary and community sector? So we did that first of all by using our strength of volunteers to make sure that they'd heard what activities were still going, what the offers still were. So we're able to share that we use an activities database, an online system called Simply Connect, to be able to share that with anybody who's front facing. So you might find it useful, if you're looking for a specialism in whether it's domestic abuse or bereavement or mental health. It gives a rich picture of what's currently active, and it's searchable by postcode and thing. So also we worked with our volunteers, and we saw a massive outpouring, didn't we, of people who were just brilliantly wanting to come and volunteer, and so we did a lot of work kind of coordinating those to the groups that needed them, and also having volunteers ourselves doing everything from driving, data inputting, being at the vaccine centres in the end of the year. We had over coordinating ourselves, we had over 1,000 volunteers before I look at who all the groups that had we recruited for. But those, in terms of food poverty, we likewise became a collection point, receiving donations from what became the Felix Project. And what we did is redistribute that out to some of the food banks and soup kitchens that had sprung up in the borough. And we went from pre-pandemic to having 7 food bank soup kitchens established within the borough to having 57 across the borough. So it's along that journey, it's fluctuated, and the offers are very different. One group may be giving 1 hot meal a week, while others are giving supermarket shopping to feed for 4 or 5 days for a family. So there's all kinds of fluctuation in those offers. But needless to say, the groups have done what they can, and a whole array of different offers has ensued. So clearly part of it for us was to try and support the coordination of that, so that we were better linking people to local offers, and also better able to link those people to the longer term support, which you've so rightly mentioned is what we're trying to get to, a state where people can help themselves rather than create dependency. So a big part of it was making sure people are better linked up with each other. Another thing that we supported was a helpline, so again connecting people into the support. So the helpline initially at the start of the pandemic was for anybody in crisis. It became, because of the lack of capacity, it became specifically for groups, food banks, soup kitchen and mutual aid groups that were coming across people with very complex conditions and needing additional kind of help into finding them longer term support within their community. So how can we better have better commission for supportive partnerships that are serving people who need it the most. So we've been working a lot around this year, and ultimately we've started coming together in what we're calling local community partnerships. And the idea behind it is to recognise the strengths that we have in each of the 6 localities in Croydon, to hear from all these fantastic, examples of the strengths that we already have, and look to work together on what can we do collectively, how can we, essentially we're providing a mechanism for commissioners to be able to see, what we're doing on a local level, what we're planning for at a local level. This should be feeding in and influencing your intentions on commissioning for Croydon's health and social care. So that ultimately it's about grounding it in what's already strong and what's working well, rather than what traditionally happens, which is something being kind of landed and maybe mismarried to what's needed. So we've been working really hard on starting those, and of course you're all very welcome to attend the local community partnerships. They're both for active citizens as well as organisations to attend. And it's about forming these community plans, hearing what's going on locally and influencing that commissioning. And also what's part of the model, part of the ambition, is to have a member of staff that could be hosted by yourselves or another partner locally, a community builder, to do some of that local work, making sure that people's voices are heard, particularly those at the margins, that are not going to attend a meeting but need to be heard and input into community plans. So I'm sorry, I've covered a load of territory there in a very short time. I hope I haven't lost you. But it's wonderful being here tonight, so thank you for inviting me.
Thank you.